Hey, this is Danielle, and today I'm going to talk to you about Huntington's disease. So, first off, just a brief history. Huntington's disease is named after George Huntington, who described it among residents of East Hampton in 1872. It was originally called Huntington's chorea, and the name chorea was used because of the dancing properties of those who were affected. Just a little fun fact for you. If you remember the song This Land Is Our Land, I'm not going to sing it, but it was sung by a musician, Woody Guthrie, and he was diagnosed with Huntington's and died of complications at age 55. Huntington's is an autosomal dominant disease. It's a neurodegenerative disease with physical, cognitive, and emotional symptoms. It is caused by a mutated gene, which is the CAG gene, and it gets repeated more than it's supposed to. The mutated gene causes the body to make a mutant Huntington protein, which causes parts of the brain to die. Most commonly, the caudate, the putamen, and lateral ventricles, and in advanced stages, the cerebral cortex. This picture is just showing a healthy gene that repeats 10 to 26 times, but in Huntington's, it repeats up to 80 times, which is just too many. And here's a drawing of a healthy brain on the left-hand side. And then to the right is a brain with Huntington's. So as you can see, the ventricles are enlarged and atrophy of the basal ganglia is definitely there. In this image, it also looks like the cortex is beginning to degenerate as well. And again is another picture of a brain here, a little bit more lifelike with MRI. And as we can see again, the ventricles are enlarged and there's a lot more black around the cortex, which is showing the degeneration. So this is quite common with Huntington's. With Huntington's, the symptoms can vary a lot from patient to patient. Physical symptoms include weight loss, involuntary movements, the diminished coordination, difficulty walking, talking, and swallowing. Often patients won't notice in the beginning if they develop a twitch or constant tapping, but often it'll be the family members that'll notice that first. The cognitive complications, though, difficulty with focus, planning, recall of information, and making decisions, this is something that is usually noticed by the patient first. They have trouble focusing or remembering things in general, just a cognitive decline. So that's usually when they go to the doctor to seek help. Emotional symptoms include depression, apathy, irritability, anxiety, and obsessive behaviors. There's also a larger risk for suicide of newly diagnosed patients, so that's something else to be noted. In the advanced stage, patients can no longer care for themselves, so they're going to need professional care. There will be a decrease in involuntary movements and increase in rigidity, increased difficulties with swallowing, and the ability to communicate diminishes as well, but they can understand what is being said, so you feel pretty trapped in your own body with that. Also, significant weight loss, definitely in the last stage as well. Another branch I wanted to touch on was juvenile Huntington's disease. So, this is when it is diagnosed before the age of 20, and this accounts for about 10% of the cases. Sometimes it's harder to diagnose. Often it doesn't have the same symptoms as Huntington's in adults. Stiff movements and sometimes tremors are just not as common in the juvenile branch of this. Often, difficulty learning and paying attention is a big thing, which can sometimes be thought to be a different pathology. Seizures are kind of the main thing that presents for a juvenile. And unfortunately, there's only a 10-year life expectancy, which is really sad. Who is at risk? Well, approximately 1 in 7,000 people in Canada have Huntington's disease. It's gene dominant, so if your parents have it, you have a 50% chance of getting it. And there's also the same risk for males as there is for females. The average age of onset is 30 to 50 years old, and it has been seen in youth as young as 8 years old, and that would be the juvenile, of course. Luckily, you can get genetic testing to see if you carry the gene, but unfortunately, it still isn't preventable. So, yeah. What is the treatment? So, this ties in with the last slide. There are no drugs to stop Huntington's, only medication to help with the symptoms and to manage the disease. Antidepressants and antipsychotics are kind of the most common things. Also, genetic counseling for patients and family, because this would be a pretty tough time to have this diagnosed. What is the prognosis? Average life expectancy is 10 to 25 years after diagnosis. And death is usually due to respiratory tract infection like pneumonia or other complications. And then, as I said before, the juvenile Huntington's life expectancy is around 10 years.